So there's a huge news out by NMC for the final year MBBS students, specifically the 2019 batch students, also for the post-interns and for the foreign medical graduates. NMC has finally decided to break the ice regarding the next exam, and yes, the 2019 batch students, the one that are going through their final year, the one which I am part of, will be the first batch to appear for the next examination, hopefully in 2024. On 27th of June 2023, NMC conducted a nationwide webinar for medical students, for which I was part of. This webinar was attended by all the 2019 batch MBBS students from different medical colleges across the country, and this was led by the chairman of National Medical Commission. Even though the webinar did clarify regarding when the examination will be conducted, how it will be conducted and so on, there are still lots of areas where clarification is required, and we hope that NMC will be clarifying those very soon. In this video, I'll be explaining what is the next examination, how it will be conducted, and what do we know so far. I'll also be mentioning some areas where we still require further clarification from the part of National Medical Commission. So let's get started. If you're new to this channel, I am Omar Mohammed, a final year MBBS student studying at Government Medical College, Calicut. I belong to the 2019 batch, the batch that will be giving the next examination. So what is the next exam? Next exam on the National Exit Examination will be a singular examination that will serve three purposes. Firstly, it will replace the final year MBBS theory examinations, which is currently conducted by the different state medical councils. So the phase 3 part 2 examinations will now be replaced by the next examination. Along with that, the Neetpg examination, which is used for postgraduate admission for the MD/MS and DND admission, that will be replaced by the next examination. And finally, the foreign medical graduate examination, which is currently used for foreign medical graduates in order to obtain license to practice in India. So these three examinations will be replaced by a singular examination, specifically the next step 1. Having said that, next is conducted in two phases. There is a step 1 examination, which I have mentioned now, which will be replacing these three examinations. Along with that, there is also a step 2 examination. Now, the important point to realize here is that the next step 2 examination is only for the MBBS students, and this will be conducted after their internship. The next step 2 examination is not used for PG admission, or as well as it is not used for the foreign medical graduate examination. That is the information that we have so far. Now, before we move on to the particulars of next, why next in the first place? Well, NMC has explained that next is introduced to revolutionize medical learning. It is aimed to overcome the current system of selective learning by medical students, where medical students study selectively to pass examinations rather than learning from a broader sense. So the purpose that NMC is aiming through next is to create a culture where medical students learn medicine in a broader sense, so that the clinical knowledge of these students can be uniformly and objectively assessed throughout the country. So what is next step 1 examination? Well, next step 1 examination is going to be an MCQ based objective examination, which will be computer based examination, and it will be conducted nationwide for all the final year MBBS students, for the postgraduates, and for the foreign medical graduates. In the meeting, NMC has also provided the distribution of different types of questions which will be asked in the examination. Compared to the NEET postgraduate examination, where there is a proportion of questions which are recall type, here there will be more questions from the clinical side, which involves problem solving and analytical skills, and that is going to make up the majority of the paper, that is for around 70%. Contrary to what we have now, the recall type of questions will be reduced to 5 to 15%, which means that there will now be a greater emphasis on the clinical knowledge rather than the memorizing and facts that we have to learn during MBBS. Along with that, we know that the 2019 batch is the first CBME batch where the competency-based medical education curriculum was implemented, and that is based on different competencies. So must-know competencies will account for 60% of the questions, and the nice-to-know and may-know will occur for 40%. What it means is that 60% of the questions will be assessing our basic clinical knowledge and clinical skills, whereas the rest 40% it will be moderately difficult to difficult questions. That's what we get from the NMC webinar. Regarding how the examination will be conducted, what we do know now is that there will be 6 papers, and it will be conducted in 3 days. So the 6 subjects are the 6 main clinical subjects which we learn during MBBS, which includes medicine and its allied subjects such as dermatology, psychiatry, and so on. there is surgery and allied subjects including orthopedics, there is obstetrics and gynecology, pediatrics, otorhinolaryngology which is ENT, along with that there is ophthalmology. Now along these subjects, medicine, surgery and obstetrics, they are going to be the major papers which has 120 questions each, and each of these papers will be of 3 hours duration, which means approximately there will be 1.5 minutes for each question. Then we have the 3 minor papers which includes pediatrics, ENT and ophthalmology with half the number of questions and half the number of time, that is 60 questions within 1.5 hours. Now how will these 6 papers be arranged in those 3 days? Let's find out. Now on day 1 we have medicine and pediatrics together, on day 2 we have surgery and ENT, and on day 3 we will be having obstetrics and gynecology. During the morning session we will be having the major paper which will be either medicine or surgery or obstetrics with 120 questions, and that will be a 3-hour examination. Following the examination we will be having a 2 hours break, and after that in the afternoon session we will be having our minor paper which will include 60 questions and 1.5 hours, and between the examinations there will be a day of rest for which we can prepare for the next paper. So that is how the next step 1 examination will be conducted. Now an important question regarding the 2019 batch students who has already completed their ENT and ophthalmology examinations. Should they have to repeat these examinations for next step 1? What the chairman of NMC has said in the webinar is that these students will have to once again write ophthalmology and ENT in their next step 1 examination. However, they will be having a concession. It is not necessary to clear these subjects by May 2024. However, by November 2024, during the next examination of November 2024, the 2019 batch students will have to clear ENT and Opthal once again. This is a special concession for the 2019 batch students as they have already completed their part 1 of phase 3 or their 3rd year university examinations. This concession will not be available for the 2020 batches and below, as they will have to clear all the 6 papers before starting their internship. As I have said earlier, this will be replacing the final year theory examinations, this will be replacing the NEET postgraduate examination, and next step 1 will be replacing the foreign medical graduate examination as well. We now move on to the next step 2 examination. Now this is only for the MBBS students. This is not applicable for our postgraduate examination nor for the foreign medical graduates, and this is going to be a clinical examination that will be conducted after the internship. So once our internship is over, there will be the next step 2 examination that will assess the clinical skills which we have gained during internship. The reason for conducting next 2 is pretty clear. That is to indulge and encourage the students to attend the clinics more during their internship rather than studying for postgraduate examination. What we now know is that the examination will be very similar to the practical examination which is conducted right now under the CBMA curriculum, which includes case presentation and OSK. This examination is going to be a simple pass or fail examination, as I said earlier. As I've said earlier, there won't be any scores, nor will this be used for your PG admission. This is going to be a simple pass or fail examination. However, next step 2 is mandatory to get your license, to get your permanent registration to practice anywhere in India as a doctor after your MBBS. The subjects that will be assessed in next step 2 will be all the clinical subjects that we assess in our next step 1. Along with that, there will be orthopedics and physical medicine and rehabilitation. So how is the time schedule? Well, next step 1 examination will be conducted twice a year. Every year it will be conducted, first one during May and then during November. Now a question is, will it be conducted in November 2023 or will the first next examination will be in May 2024? We are still not clear when that will be conducted. Hopefully next will be conducted in May 2024 because that will be the time where the syllabus will be completed for most of the phase 3 part 2 students across the country. But as I have said, we are still not sure whether there will be next in November 2023. For the final MBBS students, after the next step 1 theory examination, there will be the usual clinical university examination conducted by the respective state medical councils. After 1 month, there will be publication of the results, and then there will be starting of the internship, just like it is conducted nowadays. At the end of internship, we will be having the next step 2. Now what happens if you fail the next step 2 examination after your internship? 3 months after the next step 2 regular examination, there will be a supplementary examination conducted. either in September or March, that is 3 months after the regular examination. And if you fail next step 2 in the first attempt, you can attend the supplementary examination after 3 months. And if you still fail, what we now know is that you will have to wait another year till the next June or December. Now, a very important question is, what will the medical students do during this period? They have already completed their internship, but they have not yet received a permanent registration to practice in the country. Now, that is a very important question which we still require clarification from the side of National Medical Commission. And then we have the PG counseling and the postgraduate admit course, which is given in the respective dates. Now, an important point to realize is that since the next step 1 is conducted twice a year compared to the Neetpg examination, which was conducted once a year, from now onwards there will be PG admissions happening twice a year, just like it is happening for the INICET examinations right now. Before we move further, we have to discuss what happens with the prior batches, that is the 2018 batches and above. What we now know is that Neetpg will still be available for those batches at least until next year. We have yet to require a clarification as to whether Neetpg will be conducted in 2025 or not, or whether these senior batches will also have to write next from 2025 onwards. The final information which we have is regarding a mock test of the next step 1, which will be conducted next month on 28th of July. The registration for this examination, it came at a very short notice surprisingly, and that will start on 28th of June 2023. The examination will be conducted by AIIMS Delhi. So those are the points which have been discussed about next in the webinar attended by NMC. There are still many areas which require clarification from the part of National Medical Council. First one is regarding the foreign medical graduate examination, whether it will be conducted in 2024 or not, or whether these students will also have to write next examination. Secondly, there is no clarity about the negative mark system on these next examination. That is not yet clarified. And finally, the big question of what happens if you fail next 2 examination. What happens if you fail the supplementary examination of next 2? What should the students do after they have completed their internship and failed their next 2 supplementary examination? Should they sit idle for 1 whole year again? That is a question which requires clarification. Finally, regarding the 3rd year examination of the 2020 batch, which is going through the phase 3 part 1, should they give their 3rd year examinations this year, which is usually conducted by the state medical councils, or should they start preparing for the next examination which will be conducted for them in 2025? So these are some of the areas which we still require clarification, which we hope will be clarified very soon by the National Medical Commission. So that's it for this video. So if you have any doubts and any queries regarding this, you can mention that in the comments. Maybe someone who has a better knowledge than myself can clarify those doubts in the comment section. So that's it for this video. Most importantly, share this video with your friends, because a lot of them are going through a lot of confusion regarding this sudden announcement made by the National Medical Commission regarding next. So do share this video with your friends. Most importantly, subscribe to this channel, and thanks for watching. See you soon in the next video.